I've been in practice now for 40 years, and I started this clinic as a very small specialist clinic 27 years ago. My referrals come from a large number of different sources because medicine is joined up. It's not just one disease that a patient has. If a patient has diabetes, they may have thyroid disease. If a patient has type 2 diabetes, they're nearly always overweight. So I found that having strengths in so many different areas and being a good general physician has actually been a great help to my practice and to my patients. I see a lot of patients who have type 1 diabetes where they are insulin dependent, and together with 4 or 5 other consultants here, we're very specialist in this area. A great majority of patients with diabetes have the type 2 kind where they have tablets. They're quite often overweight. And finally, I now get general referrals from colleagues for patients who don't fit into a particular diagnostic box, and they need an experienced physician who might be able to help. Where our clinic really comes into its own is for the people with a genetic disease who nearly always are undertreated, and for people who have a much higher risk of heart disease than they are being treated for by their GP, who's giving them ordinary statin treatment. And the good news is that it's not just that I can diagnose this, but I've now been given in the last 5 years extremely powerful drugs, again, not available on the NHS, that I can use for people who really need it. Good medicine, I think, takes time. If you don't give a patient time, you quite often don't make a good diagnosis. Or if you make a diagnosis and give the patient treatment, the treatment is quite often not taken in and not acted upon. And I know what patients need in the private sector. So they need time, they need caring, and they need the doctor to be competent and good at what he does. I do offer patients the ability to contact me. And it is this constant offering of support to a private patient that actually distinguishes our service from ordinary services where you have to make an appointment and see somebody before you quite often get the assistance and help you need. When we started, it was just me. We now have over 85 consultants, and they're colleagues, and I respect them, and they're handpicked, and they're wonderful. And it's been a great joy to me that so many good consultants who are top of the tree in their teaching hospitals have decided to bring their practice to London Medical.